If you're a long-term viewer of our channel, well, you probably know that we recently gave birth to our second child right here in Germany. But this pregnancy and birth experience was vastly different from the first time around. As a high-risk pregnancy, I was not only required to go to weekly monitoring by specialists at a top university facility and have a planned C-section to ensure safe delivery, but our son also ended up needing a 6-day stay in the NICU. And while we are happy, healthy, and home, thanks to the phenomenal care that we received at our German hospital, the whole experience had me personally wondering, what in the heck would this have cost me had we given birth to Theo in the United States? Well, I did the research and brought receipts. So, let's take a look. As with any hospital stay or medical procedure, individual care is complex, and there will always be nuances from one birth to another that not only impact the kind of care you receive, but ultimately the price you pay for it. And so, speaking from my personal experience, when I was 26 weeks gestation with our second son, I went in for a routine ultrasound, and it was discovered that I had what was termed a high blood flow rate in the umbilical cord. And while I might be Dr. Ashton, I am definitely not that kind of doctor. So in layman's terms, when the flow in the umbilical cord is too high or too low, it can cause the baby to not get everything it needs to thrive. Of course, this can be insufficient nutrients to help it grow big and strong, but it can also mean insufficient oxygen. So instead of visiting my Frauenarzt once a month, I was sent to the Prenatal Diagnostic Clinic at the University Hospital for weekly ultrasound monitoring. And basically what they were monitoring were three big things. How's the pressure in the umbilical cord doing? Is it getting any worse? How is the baby doing? Is he meeting all of his growth targets? But also, is the pressure in his brain remaining stable? And that last part is actually really critical because if left unchecked, the high blood flow in the umbilical cord results in one thing, and that's stillbirth. So the doctors were extremely careful to make sure that they monitored him every single week so that they could catch this in time and deliver him early if need be. But just as high as my gratitude is for the level of care and attention I received during my pregnancy, it is to my complete amazement that all of this cost me nothing. And I'm serious, I can't speak highly enough of the prenatal care I received and the postnatal care I had in the hospital during my son's NICU stay. And I wish I could show you what that cost me, but quite literally, I don't have a bill to show. I'm a member of the public health insurance company, the AOK, and as a member of universal healthcare in Germany, it means that as long as I pay my social contributions towards that health insurance policy, my healthcare is covered. Whatever I need, whatever my baby needs, there's no bill to speak of or talk about. Not for the weekly ultrasounds, the blood tests, or consultations with some of the top neonatal specialists in the country. Once the initial issue was detected by my Frauenarzt, I was given an Überweisung, which is a fancy pink piece of paper saying that the additional treatment was approved by my primary care physician. And at that point, my insurance took care of the rest. No questions asked. And this is extremely important because that is very much not how prenatal care or health insurance functions in the United States. In the US, I had an employer-based PPO healthcare plan offered through Blue Cross Blue Shield. And while there are a litany of plans with different copays and deductibles out there, my healthcare plan was actually pretty good as far as private healthcare goes. But had I experienced the same prenatal complications in the US that I did here in Germany, my bill would have looked like this. Each time I would have visited the specialist, presuming that that specialist was at a hospital that was in network, which isn't all of them, I would have had to pay a copay of $40. So in my specific case, I required monitoring every single week for the final 11 weeks of my pregnancy. And as a general rule, I just should mention, copays typically don't count towards private healthcare deductibles in the United States. So from that point forward, my healthcare billing would have likely happened in two parts. The first is that I would have to hit my yearly out-of-pocket maximum, which under a family plan means that I would be responsible for 100% of the costs, all of the ultrasounds, blood tests, and consultations up to $1,000 US. Then Blue Cross Blue Shield would enter into a cost-sharing scheme, in which they would cover 80% of my costs and I would pay 20%, until I also paid a maximum of $5,500. And again, this is presuming that the specialists at the hospital, the private labs who are running the blood work, and the tests being performed are within my network. As you can see from my insurance disclosure, if any one of those service providers were out of network, I would have had to pay significantly more. And keep in mind, all of these costs are in addition to my monthly premium, in addition to my copays, in addition to the cost that I'm paying for my prescription drugs. None of those go towards my deductible. Now, the cost of birth is complicated. No two patients or two births are alike. But what I also found interesting is that even if you could control for that, even if you could make two identical families and have two identical births, the cost would still vary depending on which hospital they happen to give birth in. Because the amount that they're ultimately billed by a hospital, even for a spontaneous birth or a C-section, can vary dramatically in the United States, all based on which insurance you have. Because unlike here in Germany, the costs of services aren't regulated or fair across the board.
Blue Shield of Illinois will no longer list Springfield Clinic as an in-network provider.
Instead, individual insurance companies will negotiate prices with individual hospital networks. Everything from the price for a single pill of pain medicine to the cost of full-blown general anesthesia. So if you're planning on having a baby in the United States, how in the heck are you supposed to know how much it's gonna cost you? Well, the closest you can get to finding out what you will be expected to pay is to pick up the phone and call both your medical provider and the insurance company to ask. But fair warning, they're probably gonna tell you that every situation is different, so we can't provide details on the numbers. And then they're gonna quote you a figure in the thousands that you're quite frankly just going to have to accept. And even then, that number won't probably be exact. If you throw in other factors into the mix, like any complication happening during the birth, that number will change. But knowing that now and being able to kind of prepare ahead of time is a heck of a lot better than just getting a surprise bill in the mail. And sadly, that surprise bill is all too common in the United States. So I told you I was going to bring receipts. So let's take a look at a couple of these hospital bills. This bill was sent to a mother who gave birth in Honolulu, Hawaii. She gave birth vaginally in a spontaneous delivery in February of 2017. She had an employer-based healthcare plan where she was responsible for covering 15% of the bill out of pocket. The patient was admitted at 9 p.m. on the first night, which means she was charged a full day's rate for only 3 hours. She also had to stay an extra day for some additional monitoring due to complications. And in total, the cost of room and board alone in a shared room cost her $8,300. Also, at this point in the video, it is worth mentioning that in the United States, it's very common that if you give birth vaginally in a spontaneous delivery, you're probably only gonna spend 24, maybe 48 hours in the hospital after birth. Whereas and a C-section might be 3 days. But here in Germany, things are a lot different. After a spontaneous birth, you're generally going to stay in the hospital for at least 3 days. And for a C-section, anywhere from 5 to 6. You of course can leave sooner if you wish, but you don't necessarily feel pressured to do so because of cost. And you can stay long enough to even have your first baby's wellness check done in the hospital by their pediatrician, saving you a trip to the doctor's office in the first week of the little one's life. But back to the bill. Now, I won't break down each of these costs individually, but I wanted to point out that in this bill, the patient was charged nearly $16 for something called Cited docusate sodium. I hope I'm pronouncing that right, but that's $16 for a single packet of stool softener. She was also billed $77.20 for 9 pills of oxycodone, a prescription strength painkiller. And lanolin, that's nipple cream. that cost $7 for a full bottle at the pharmacy, her insurance was billed $43.10 for a one-time sample size packet. And had this patient had no insurance coverage, she would have had to pay a whopping $13,440.35 out of pocket. Now, luckily, she did have insurance, and taking all of the medical costs incurred relative to the delivery and the hospital stay into account, her total out-of-pocket expense was $2,553.15. And now, in the grand scheme of things, in the United States, what she actually paid out of pocket was relatively low because she had a pretty uncomplicated birth. She didn't need any crazy interventions, and she didn't end up needing a C-section or general anesthesia. But as you can see from some other bills posted on Reddit, once you start to need those things, the cost of your bill can skyrocket. This new mom, who gave birth in 2020, had a hospital stay of 3 days in addition to her C-section and had a pre-insurance bill from the hospital of nearly $70,000. And this family, who gave birth last year in 2022, had a bill of over $100,000 for the labor and unplanned emergency C-section. And now, again, these are pre-insurance costs, and I really should be fair and balanced and say that the majority of Americans do in fact have health insurance. With the latest data estimating that in 2021, 66% of Americans had private health insurance coverage and 35.7% on Medicare or Medicaid. But that still means that 8.3% of people, or 27.2 million Americans, did not have health insurance at any point during the year, with a sizable portion of that group being pregnant people and those of childbearing age. But you know, what I find just as equally as fascinating as an American living in Germany, I mentioned, not only do I not see a bill, but in the few instances where I ever have received a medical bill in the mail, they look dramatically different. But in each of those examples that I shared, in the US, you see an itemized bill that includes all of the charges, down to pharmacy charges and medical supplies. Even if you have insurance that kicks in, insurance companies almost like to say, yeah, you only owe $3,000, but look how much it could have cost you had you not had our insurance. And I feel like that probably plays somewhat into the American psyche, like, I'm getting a really good deal with my health insurance. Even though they're probably not. Because here in Germany, children are entitled to full public health insurance coverage. And since my hospital stay was relative to Theo's birth, I paid nothing. I never received a bill for the entire 6-day stay or the C-section surgery. And that's actually really refreshing too, because as a family here in Germany, we don't have to set aside money each month to pay for medical incidentals that just pop up. Because we've already paid our social contributions, we've already paid into our healthcare. It's taken care of. There aren't any surprise bills that are going to come in the mail that could potentially heavily impact our monthly budget. And that's something, by the way, that the overwhelming majority of Americans can't do and won't have. And that's true whether or not you're insured with public or private healthcare in Germany. We don't have to worry about the costs of standard care like medical exams, consultations from GP or gynecologists, blood tests, ultrasound examinations, and preventative examinations to test for risks. But our coverage also includes things that are considered extras not covered by American health insurance, like a midwife, birth preparation courses, pregnancy gymnastics, or postnatal Pilates courses. However, it is worth mentioning that in Germany, there is also private health insurance. And sometimes with private healthcare, you might have better access to midwives or different pediatricians. And private healthcare in Germany, depending on your plan, may also pay for nice little perks at the hospital, like a private room. But as a patient, you have that option. And if you're an expat or immigrant family who's considering starting a family and want to consider your insurance options, you can book a free consultation with Feather Consultants to get honest advice for your situation. And Feather offers both public and private healthcare, and it's fully digital and 100% online. And by the way, if you're considering switching from public to private insurance, you should do so prior to getting pregnant, as pregnancy is going to be considered a pre-existing condition. But not to worry, Feather does make switching super easy, but it's worth looking into this as early as possible. So make sure to check out Feather at the link below, or to book a free consultation with a Feather expert who can help you decide if public or private insurance is the right fit for you. Now, no one expects their baby to wind up in the NICU. But every year, 10 to 15% of babies born in the United States, roughly 500,000, do for reasons including prematurity, heart problems, birth defects, breathing irregularities, and infection. And here in Germany, that rate stands at roughly 8.7%, one of the highest recorded in Europe, but significantly lower than the United States. And our newest son's start to life contributes to that statistic. Due to breathing irregularities, he required a 6-day NICU stay immediately after birth. And that brings me to my next point, which is that one of the major differences between health insurance in the United States versus here in Germany is that, especially with public healthcare, you actually don't pay any more to insure your children. As you saw earlier when I shared my employer-based PPO plan, rates were based on whether or not I was solely insuring myself or if I was insuring a family. But here in Germany, as a worker enrolled in the public health insurance scheme, your contribution is fixed. It doesn't matter if you have 1 child or 10. In fact, if your spouse is a stay-at-home parent and doesn't earn anything more than a mini job, they too can be covered under your health insurance at no additional cost. And so another huge difference from the United States to Germany is that the US sees that brand new baby as a brand new insurable person. And that baby's costs are often calculated completely separate from their parent. And when a NICU stay is involved, that cost can be shockingly high. 2 years ago, NPR reported on the realities of medically complex babies and their care, and the case of a Florida woman, Dorian Bennett, and her infant son, born 2 months premature. Her son had health insurance through his mother's employer, Assured Partners, where she works as a licensed property insurance agent. However, with a neonatal intensive care unit stay of 56 days, the little one needed highly technical, life-saving respiratory and nutritional care until his organs matured. He also received laboratory, radiology, surgery, cardiology, and audiology services and treatments. The mother's service provider, Advent Health Orlando, was billed $660,553 for the NICU care alone. Thankfully, the mother was not responsible for the entirety of this cost. Again, she has private employer-based insurance, for which in-network providers had a $6,000 deductible and a $6,000 out-of-pocket maximum for the family. So in total, she paid $12,000 for her and her baby's care, outside of monthly premiums. And while that was only 2% of the cost that was ultimately billed to her insurance company, $12,000 isn't pocket change. And that's money that the majority of Americans, quite frankly, just don't have. So in a very real way, Dorian Bennett and her son's care illustrate why medical bills and the associated drop in income from medical events account for 2/3 of personal bankruptcy in the United States. But my son's NICU stay in Germany cost us nothing. We never saw a bill because there wasn't one to see. It was covered by our public health care. Now, at this point in the video, I feel like it's probably safe to wager that a lot of our European audience is probably experiencing some sticker shock. But I really need to underscore that the total cost that is billed to an insurer and the amount that the insured person ultimately pays are often dramatically different. However, there is a loophole, a very important loophole that I should probably also mention. And it can have devastating financial consequences for an American family. Because unlike short-term illness and acute injuries, pregnancy lasts 10 months, which means more often than not, it's unlikely to be conveniently occurring within a single calendar year. In other words, if you're like me, your pregnancy started in September and ended in May. But if you take a look at my employer-based healthcare plan that I had in the United States, there was a very specific term that they use, and that's calendar year. In short, you start from scratch all over again on January 1st. So let's say you gave birth to a baby in December, and that baby needed a NICU care stay that extended into January. Well, starting January 1st, the calculation of all of those out-of-pocket deductibles and maximums, you start all over again. You start from zero. And this factor alone is one of the reasons why researchers have found that most parents become financially burdened from their pregnancy and the delivery itself. Estimates show that low-income families spend around 19% of their household income on healthcare expenses, and that percentage rose to 30% when you include health insurance premiums in those costs. And even when families with greater financial security, pregnancy can still come with a lot of expensive surprises that you might not be prepared for. According to the Kaiser Foundation, 45% of single-person households did not have more than $2,000 available to pay for medical bills. Almost a third of multi-person households similarly lack sufficient cash to cover pregnancy and childbirth's out-of-pocket costs. And there are costs beyond the medical bills that a pregnant person faces. Upon giving birth, people may forego wages if their job doesn't guarantee paid parental leave. And caring for a new child can mean incurring other new expenses, such as infant health care and new non-medical costs. And ultimately, the loss of income if you don't have paid parental leave, including the costs of healthcare alone, significantly increase new families' risks for personal debt. Okay, but before I let you go, I actually have a very specific question that I want to ask the audience this week. If you're watching this video from right here in Germany or any other country with a public healthcare scheme, what are your thoughts on the quality of healthcare that you've received under a public insurance plan? Because in the United States, probably the closest thing that we have to universal healthcare is Medicare.
Medicare for all will lower healthcare costs in this country by $450 billion a year and save 68,000 lives of people who otherwise would have died.
But proposals from politicians for programs like Medicare for All struggle to gain the majority support. And I actually find that pretty curious because despite lower payment rates for physicians from Medicare than private insurance, Medicare beneficiaries are less likely than people with private insurance to report problems of finding a new doctor. Medicare beneficiaries also report foregoing medical care at similar or lower rates than older adults with private insurance. And compared to adults 50 to 64 with private insurance, Medicare beneficiaries aged 65 and older were more likely to report being very or somewhat satisfied with the overall quality of their care.
Payments for services under Medicare would break the bank of a hospital.
Every hospital in this country would close.
However, opponents of proposals for Medicare for All or any other public option that adopt Medicare rates often argue that a broader use of Medicare rates would cause hospitals to lose money, which would lead to cost cutting that adversely affects the quality of patient care and potentially spark the closure of some hospitals. So in short, I guess I want to ask, do you feel like the amounts that are charged by hospitals or physicians to the insurance companies, while they are definitely lower than what are charged in the United States, do you feel like that has had a negative impact on the quality of care that you've received in your country? It's definitely a complex question, but I know that it's one of the big barriers to many Americans for wanting to hop on board the Medicare for All train. So please, let me know your thoughts down below in the comment section. And be sure to check out Feather. They make signing up for health insurance super simple, and they're a great choice for English speakers right here in Germany, since they offer everything in English. And as always, if you enjoyed today's video, be sure to hit that thumbs up button. And for more content from the Black Forest family, hit that subscribe button. So, I'll see you next Sunday.